Hello, my coding family. How's everybody doing? How's y'all's week? How are the book preps going? How are your notes? You got those differences between those CPT codes noted? How's the practice exams going? Are you guys practicing? Can you guys see and hear me yet? Can y'all see the starting screen? Can y'all hear me? Did I hit all the buttons right? Let me see, where's chat? Hey Tamara, hey Mabel, hey Pearlie, hey Katie, hey Denise, Rachel, Eva, Marshall, Monica, Tamara, good to see you guys. Anybody taking their exam this weekend? Maisha, Katie? A little bit. It's been crazy this week. I know, it has. Hey Katie, hey Neva, hey Charles, Rachel. Tomorrow? Oh my. I took it last Thursday and bombed it. That's okay. It's a learning process, right? You never know what to expect until you get there. Now you know what to expect. On the 29th, you retake yours on April 28th. Awesome. Let me see if I can find my little document about. There it is. See if I can't find any new little vocabulary terms that we want to throw in here. Oh yeah, that's a good question I haven't seen in a long time. That's a good one. Copy. This one for today. Let me set that back to starting so that I can format this question on there correctly. Did everybody get a chance to see Tuesday's live? It was a good one. We did at the end, instead of doing practice exam questions, we just kind of role played and did a deep dive into some lab and path codes. So if you haven't seen Tuesday's live, it's a good one, especially at the end. If you're taking your exam on this week, be sure you know terms that I'm posting into chat. You know, any of these terms could be questioned on the exam. The types of bones. Do you have a listing of which bones are flat, which bones are irregular. Do you have that listing in your book somewhere? Parts of the eye, they love that one. What's internal and what's external on females? Posted it in chat, maybe. If no, I got too many words. Here we go. Here we go. That could be helpful. How many lobes are in the lungs? How many are in the liver? Those kind of things. Posting it in chat. So, how many lobes are in the brain? Those kind of things could be helpful during the exam. Yep, we got 5 in the lungs. Yep. Dystonia. Do you know the definition of dystonia? You're welcome. Do you know the definition of that? They love series, like what comes next. Sometimes they ask that kind of stuff. This one was a question at some point in that series, you know, when you're doing airflow, lungs, nose, trachea, bronchia, and then what comes next. They love stuff like that. What does the urethra do? This one. This male body part seems to always be on the exam. I did the CKDs yesterday. This one right here. Trichomycosis. I'm not saying it right. That word has been on the exam quite often. Used to. I haven't heard this being on the exam in a while, but a lot of people don't tell me much about what's on it recently. But modifiers are classified by different classifications. Like this is a list of pricing modifiers, and then this is a list of payment modifiers. That used to be on the exam. And where they find that information in those manuals, I don't know. Orthons, yep. Hey Robin, good to see you. I'm just chatting. And then we have location modifiers. You guys should know the difference between those. Right, left, fingers and toes, that kind of thing are all helpful to know. Be sure you know what the prudential nerve is. Just in chat. Know your Medicare basics, what's inside Part A, Part B, Part C, those kind of things. Gives you a few more procedures and stuff that may have been on the exam. TMJ question, a thoroplasty, a shind type repair, septal defect, a patch closure, question on ECMO. There is a decision tree in the CPT book with ECMO in it, and a ruptured aneurysm and what ARDS stands for. Welcome, Robin. Welcome, welcome, welcome. Anyway, hope that list is helpful. Let me know if you have any questions for tonight or particular codes you want to know more info about while we drop into the first question for tonight. What about a bone that develops in a tendon? What is that called? That's a question I haven't done in a while. Hey, Tisha, good to see you. We have 31 in right now and 11 likes on the live. Thank you, guys. Oh, yeah. Oh, I got some more anatomy charts I was working on PDFs I could show you guys. I have one posted on my website, but I'm working on some more to help you guys. Still having trouble sequencing? Working on the E&M notes. Great, Rachel. You got a question about surgery? Yep, the IOL. What is that? Posting your answer in chat. That is talking about our intraocular lenses. They're clear artificial lenses that are placed in the eye during cataract surgery. I upgraded my mom's. You're welcome. Why are you over here? Escape. Do you have the answers to this first question? Is it possible to study medical coding? Yep, sure is. Absolutely. I teach you how to pass the exam from... Yeah, isn't that crazy, Christine, about the layers of the eye? Yes, that question kills my soul, doesn't it? Let me see if I can show you where the answer is. A, B, C, D. What door? If you want to, that's fine, boo. Let's see. So see if this thing's still working. Nope. Nope. Okay. Add video capture device. Still not working. Still working. Working. No. Nope. Not working. Let's add a video capture. Come on. You can work. There we go. So if you're in your ICD-10 book and you go to the anatomy of the eye chapter, chapter 7, there is a place in here where they talk about the different layers of the eye. Kills my soul. I don't know if I have it listed in here, but they talk about the layers of the eye. So check out your anatomy of the eye if you have an ICD-10 book that does what ours do. This one's the 2022 one. I need to get out the 2023 that has my notes marked in it. But the right before you start diagnosing a section of the eye, it will list out the diseases of the eye, but also tell you all about it. Right here we've got, something about in the middle layer of the eye is talking about it, and then it'll keep telling you about all the different layers, the parts of the eye. So read that carefully in your ICD-10 book. The ICD-10 book has everything you need. Of course, that was A. Perfect, guys. What about this one? Which department handles release of patient records? See if I can find it. Used to be on the exam was this question about what is the clear thin layer that covers the front of the eye, but I know there's 3 layers of the eye too. There's that other question too. All right, hey guys, I'm trying to figure out the certification I might go for next. I've been certified since September. CRC would be a really good one. A lot of offices are doing risk adjustment with their population. Plus, it's only 1 book, so that's kind of handy dandy, where you don't have all 3 books, you just have the ICD-10. The AMA puts out a really good book for that. There There you go. Not that this has anything to do with this question. This is just an answer to your question. What are the 3 layers of the eye? So be sure you have that written out in your CPT book somewhere where you can find it. And then that way you've got it written and you can pick out the correct answer the next time you see that question. I can put it in the chat too. You're welcome. Y'all remember anything else? Y'all let me know. What do you guys think is the answer to this question? Which department does the release of records? I had D's. Good job. Perfect. What about this one? What's the difference between coding surgical and diagnostic procedures for outpatient facilities and providers? Is there no difference at all? Is it the diagnosis codes? Is it the modifiers? Or is it the CPT codes? Three layers of the eye. Middle layer is the vascular layer. Outer layer is retinal pigment epithelium. The inner layer is the transparent covering of the body, which is the retina. Ooh, that sentence is just horrible. It's like they write the words as most complicated form as possible. Ugh. I still don't see a correct answer for this question. What's the difference between coding surgical and diagnostic procedures for an outpatient facility? What do you guys think? Some of their guidelines and stuff they just write. It's so confusing. I still, okay. I got one person. Oh, there we go. We got a couple of more. Everybody's starting to get it now. It is your modifiers. You need the modifiers. Modifiers and payment methodologies are different for outpatient facilities and for the providers. In most cases, the codes selected for surgery procedures and diagnostic procedures are the same whether you are coding for outpatient facilities or for the provider. Modifiers and payment methodologies are the differences for our outpatient facilities and the providers. An active treatment plan for therapy services must identify which of the following. Is it a date of the plan, a list of the diagnoses, the diagnosis goal, or goals in surgery procedures. What do you guys think? What must be in a therapy surface plan? This question was on my CPMA exam. It was written differently, but it was the same question. And it could also be on the CPCO exam. But you guys should know what's on a therapy plan, treatment plan anyway. It's good to know. You've got two answers that have the word diagnosis in it, which even when you're looking for correct answers, seeing that two of them start off with the word diagnosis makes you think that these two are super similar. That would have me eliminating A and D, and then I'd just see what my difference was. A list of diagnoses the patient's been treated for in the past, or the diagnosis and goals. Yeah, there you go. Well, my expertise is how to pass your medical coding certification exam. I'm not really the best person for job advice. So I haven't had to try to find a job in multiple decades. But credit history? Well, I would start off with my foot in the door with a particular job that might not ask for credit history, like FEMA right now is hiring remote anybody who will get on board with them, and it's a federal government job. So if you want to help people who've been in disasters right now remotely from home and have a federal job with benefits and pension and all that, you could get on with FEMA. And then as you pass your CPMA or CPC exam or whatever, you can transition into a medical coding job remote from home, also for the government, for either TRICARE or any of the state or federal clinics and stuff. They all need coders, and they always hire in-house before they hire out-of-house. So I would transition from one position to another once I got my foot in the door. Don't forget to watch last night's replay live. It was posted a couple of hours ago. I went through a whole list of job opportunities and how to aggressively get yourself into a position you want, with tons of tips on that repeat live last night. So I have a lot of good advice for that. Physical therapy provided on a regular basis at a hospital outpatient facility requires which of the following? Is it reoccurring account numbers, specific documentation, diagnosis, or reoccurring account number again? Since reoccurring account number is down twice, I'd look hard at those two answers and see if it's reoccurring account number to capture all charges, including surgeries performed in the past, or would it be all charges and diagnoses to support medical necessity? What do you think? Monday the 26th. Let's see. Did I not do that? Let's see. Like today I did yesterday's, which was the 6th. So we're looking for the 4th. The 4th. What day was this one on? What day was this one on? This one. The 19th, I said. Weird. Let me write a note down. 3, 4, 24, 5, post. Gotta see how many minutes that one was long. How long was that one? Let's see.
I'm in Sapa.
I don't know if I can get to it right now because I'm live. Nope. That's unhelpful. Let's see. Go live center. Yep. And then it looks like the live from the 4th did not record from TikTok. I don't have it available to download for some reason. I only have February 28th and then March 6th. I don't know what's wrong. Sometimes they don't record, and that's always unfortunate. That sucks. View more. Let me see. View more. Yep. March 6th is the one I downloaded today, and then February 28th is the only one they have recorded before that. That's it. That sucks. That's why we moved over to YouTube, so that I wouldn't lose them. This one also is D. What are partial hospital services? Is it situations where services cannot be performed? Situations where only one department can be utilized? Full-day programs, psychiatric services, or programs requiring the patient to stay overnight? What do you guys think about that one? We're fixing to get into E&M questions in just a second. What do you guys think? This one's crazy. What are partial hospitalization services? This one is tricky because it happens to be the full day. You can see how they're trying to confuse you with mental psychology, you know. They're calling it partial hospitalization services, but in the answer they're calling it a full day. Full day programs for psychiatric services are actually partial hospitalization services for full day programs. It's crazy. business office in the outpatient facility is commonly referred to what? What is the business office? D, good job. Financial services, yes. What about what constitutes a consultation? This is really important to know these differences for sure. A little bit bigger. Is it when a nurse asks another nurse for directions, a nurse asks a physician for advice, qualified provider seeks advice from another provider, or qualified provider asks another qualified provider for care? What do you think? Got some C's and D's. Yeah, it's definitely between those two. Are we seeking advice or are we to provide care? When they're doing a consultation, are we seeking advice or are we providing care? Think about how the referral happens. The physician gets a piece of paper to say, hey, come look at this patient. Then that physician sees that patient and sends a letter back to the primary care physician. What's inside that letter? Is it to say, okay, I'm taking over and doing this and this and this to your patient? Or is it, I suggest you order this test and give this patient this medicine, and I'll see him back in a year? That'll tell you what the answer is. It's not to provide care. The other doctor doesn't provide care. The other doctor only provides advice back to the PCP. If they're providing care, then they're taking over treatment and care for that patient, and then that way that patient is a new patient if they're providing care. If they're only advising and sending a letter back, then it's a consultation. So that one was tricky. Tricky, tricky, tricky. Anybody know what a charge master is? They all start off with listing. One of them says everything, one of them says major, one of them says procedures, and one of them says surgical. Still don't see a correct answer for this one. There you go. A is right. Good job, Maisha. Good job, good job, good job. Good job, Robin. It's Mara. Good job. All right. Which of the following is not paid by Medicare under the Direct Graduate Medical Education Program? Is it fellows, teaching, nursing, or residents? I did a live on Lab and Path Tuesday. Did you watch that one? The last part of the live was all Lab and Path. We went through that section and we did role playing, figuring out what the answers are based off certain situations. We just did that on Tuesday. The privacy rule for HIPAA is managed by what department? B, medical records, actually. Anytime you're going to see the word HIPAA, remember to look for medical records, right? Match those two up every single time. Who do teaching physicians oversee? Is it assistants, interns, residents, or non-physicians? C. Good job, It's. Good job, It's. You're on a roll. I can't wait for you to take your exam. You're going to do so well. If an ASC can be either independent or affiliated with a hospital, which of the following statements is not true about ASC? So we're looking for an incorrect answer. CMS requires services to be billed on a 1500, or certain surgical procedures have payment limits, or hospital outpatient surgery centers that are provider-based are paid the same as ASCs, or procedures performed by an ASC do not require an overnight stay. Which one is not true? You're looking for an incorrect answer. I got B, C, B, and A listed for that one. Funny. So what's more likely? Incorrect, right? We're looking for an incorrect. CMS requires they be billed on 1500. Yep, that's correct. Certain surgical procedures have payment limits. Maybe. Some of them they cut off and you can't have any more. Hospitals are paid the same as, yeah. Do hospital surgery centers get paid the same as ASCs? Probably not. They're on a different payment scale. All right, enough of that stuff. Let's do some E&M. What is our header for code 99305? What's the header for that? Do you know it off the top of your head? Have you learned your little flashcards of E&M? What header is 99305 under? It is super handy to already know what the headers are if you can. For a lot of these E&M sections, it'll save you some trouble during the exam. 99305, what is its header? The red header, yep. It is new nursing. Good. 235, what's the header for 235? The red one? Hey Samantha, good to see you. We've got our admit and discharge all in the same day. This is our admit hospital. And our 310, what kind of code is that one? What header is that one under? We know this one is our admit hospital. This one is subsequent hospital. So we've got 2 office visits billed in the same day if it's answer D. So what are we coding? Something that's moderate. MD visits the patient at a nursing facility. Decides to admit the patient and put them in the hospital. It has C's and D's. I've seen this one answered two different ways. We do have an examination done with a history done at the nursing center. At the hospital, we have orders for all these meds and a MDM of moderate. This particular one wants only the admit to be done because there was probably, with the nursing home facility, all they did was 2 of the components, not all 3. They didn't leave any orders for the nursing staff to take care of the patient afterwards. So you can't bill for the nursing facility if there was no orders left for the nursing staff to take care of the patient after you leave, right? So we're only going to bill the hospital stay for this one because this has orders for staff, take care of the patient, leaving the patient there, and then there's stuff for people to do while you go home for the evening. It's a crazy question for sure. Think about it that way, that if the patient's no longer there at the nursing center and there's no orders for the staff to do anything, think about it that way. All right, what header is our 99291 under? And what header is our 99232 under? Got 2 different headers to think about. Yep, we've got our critical care, and then we have our subsequent hospital visit. What are we billing for today? Our total time for critical care was 30 minutes. We have a patient who was called into ICU for a patient. Who is in respiratory failure, means they're actively dying. So they had to do a bunch of stuff, get the patient intubated and vented, pump in a bunch of meds, and get them going again. Yep, it is tricky. Be sure to check out your critical care chart here. What is our 31500? What is that CPT code? Three 1500. That is our intubation, endotracheal emergency procedure. We're going to open up the airway, right? Do you get to bill for that? And the time that it took to do this, and then also get to bill critical care that includes the time in performing that intubation. So if it took us 3 to 5 minutes to intubate a patient, between ordering it, getting the tray out, the doctor finding the proper cords, stringing that, getting the patient breathing again, we have to take that minutes that we use to do the trach off of our total time of critical care, because we're billing for that. We're getting paid for that. If we include the time into our critical care, then that's double billing for the same thing, and fraud, of course. So we have to take off our minutes. And if we take off 3 to 5 minutes for doing that intubation, then that means our total time for critical care is no longer 30 minutes. And we have, of course, rules set in place for anything less than 30 minutes. You have to use an E&M code for that. So because we did something and they wrote in here, includes the time for performing the intubation, the reason why they wrote that in there is because they want to know if you understand that even if it took us 1 minute to do the intubation, doctor was Speedy Gonzalez, then it's still 29 minutes of critical care. And you can't bill critical care for 29 minutes. So you can't do A and B. And since you know you're going to have to bill for intubation, we know our answer is C for this one. Does that make sense to everybody? Intubation is not included in your 291. So we've got a list over here in critical care, or it says critical care includes chest x-rays, pulse ox, blood gases, ECGs, blood pressure, gastric intubation, pacing. Those kind of things are all included. The ventilation management, but not the trach. So that code is not listed there. And you can see there's no 31500 listed here in your critical care guidelines. Good, 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 good. Same thing. It just says that critical care services guidelines state that the time spent performing separate reportable procedures should not be included in the time reported for critical care. Time spent performing the intubation is a reportable procedure, but is not among the list of procedures listed for the critical care services. So the time spent performing the intubation is deducted from the 30 minutes, resulting in 25 minutes of critical care time. I don't know. I wish I had a list of how much time you take off per procedure for critical care. That would be great, but I don't know where that's listed. I haven't found it yet. But I haven't done like major research on it yet, but it would be nice. This is the only indication that I have that says it's 5 minutes. And I've seen intubations done in a lot less time than 5 minutes. So I don't know. But even if it took 1 minute, it's still 1 minute off, and you can't bill for 39 minutes of critical care time. Anyway, I hope that helps. Where are cataracts located? I've seen this question on the exam before too. They love their eyeball questions for sure. And I hate eyeballs. I refuse to learn it. I just never wanted to treat patients with eyeball stuff. I don't like eyeballs. And I don't like toes either. What do you guys think? Everybody saying C? Good job. There we go. In arteries and veins, there is an inner layer that helps circulate blood flow. What is it called? Yep, endothelium. Good job. Perfect. Another name for a left coccyx flexure is what? Got spacing wrong on this one. I spend half my day formatting Word documents. Such a pain. Perfect. Scooch that guy back over where he's supposed to be. Perfect. A is perfect. Good job. What is the main difference between hypertrophic and dilated myopathy? You can find the answer to this one in your ICD-10 book, by the way. Is it hypertrophic myopathy means the heart muscle is thickened, or it means the main chambers have been enlarged, or does it mean that there's an infection in the heart muscle, or is it caused by hypertension? I got A's, B's, and C's. Let's see. In your ICD-10 book, you should have some stuff like this done, where you have the differences in what they look like. It's kind of helpful for this question. So I'm around ICD-10 code I-43 in my particular ICD-10 book. There's also in my ICD-10 book, before we start coding the circulatory system issues, we've got the common pathologies. They go in depth on all kinds of diseases and processes and all the arteries and stuff. So, and then after my extensive notes on all the cardiology stuff, we've got just a few pages right after that. We've got our myocardiopathy stuff. I know every ICD-10 book is set up differently, but usually they have pretty much the same information. Means that the heart muscle is thickened. That's why you got that thick wall built up on that cardiomyopathy picture, where it's just super, super thick down at the bottom. All right, which radiology code? We've got 2 of them in the 5s and 2 of them in the 6s. So those 2 and those 2 might be separated by, something a little different. Let's go look. 77053 is our first one. 053. And 54 and 61 and 65. They're all under the same header. Okay. What's our differences? Some of them do multiple, some of them do single. It's one of the major differences. What do you guys think the answer is? Everybody likes B. Perfect. No issues with that. Good job. Perfect, perfect. All right. What header are we under for 204? A new patient, office visit. What about these two? Our ER. What's our 88? 288. Anybody know the header for that one? What is our header? Yep. EMS. What do we ask to code? What happened to our patient? What is our patient's status? Where are they located? We have a patient who's rushed to the ER after hitting their head. Don't much care. We have a history, physical, MDM, and moderate complexity. Doesn't look like they've admitted them for anything. Doesn't look like they're in new patient. Doesn't look like they're EMS. We just have to match our MDM for moderate. Yeah. Easy peasy one. Nice. This one was on my exam. I can't remember if it was 2 leads or 12 leads or what it was, but something like this was on my exam. Sorry, turning on the space heater. I sat still too long. Circulation. I remember something about an ECG being on mine. Anybody else remember this question on their exam? Or something similar? What's our differences? Just look up the differences between the codes. See if there's any header differences. Make sure you're doing the correct one. Don't let them fool you. What's our differences between the 40s and the 00s? 930. Don't let those acronyms Portfolio. 3. Oh, did we do an ECG with 12 leads? That's our 000. And our 15 is cardiovascular stress test. And then our 40 is an ECG with 1 to 2 leads or 1 to 3 leads. And then our 41 is just the tracing only. So we're looking for one that does just the 2 leads. So since 000 does all 12, we can't use that one, right? Good job. Good night, Samantha. Best of luck. Drive safe. Anesthesia. What do you guys think about this one? We've got 2 with the same answer for 30. I would run to that code, see if that is where we're at. 00530. For a transvenous pacemaker. Is that where we're at? Is that what we're doing? I got some D's and A's. We did do a transvenous pacemaker. So our 32 is for venous circulation. And then our 34 is for venous defibrillator. So we know both of those are incorrect. We know we have to do this. Our patient is over 70, and we do have some qualifying circumstance codes that are in our guidelines that says more than one qualifying circumstance might be included here. Our codes for that are if our patient is over 70 or younger than 1 year of old, we need to add that code to it. If we're doing something that's just an emergency situation, we're going to add our 9940. So be sure and don't forget about these qualifying circumstance codes that are in your anesthesia guidelines in the front of your book. Because they will test you on this one. For sure. D is correct. Good job, guys. Good job. Oh, I gotta switch this down. And this one may be more of an auditor one. CAHS is which of the following? Yeah, y'all probably wouldn't know this one. This looks like an auditor question. But can we guess what it is? No more than 25 is in 3 of the answers. Then we only have one answer that says many swing beds as needed. We have used exclusively, which include, used for either. B and D are the most alike. It is D. Good job, guys. I think the rest of these are probably more auditor ones. Let me look for something else real quick. See if I've got anything else that I have that is halfway prepared. I like this one. What about this question? Which scenario qualifies for a modifier 25? Would it be a nurse assessment, a history and physical, a patient's return to the office, or preventative medicine? What do you guys think? Sometimes they do ask questions like this: which scenario fits all these situations or none of these situations? They like that kind of stuff. Got some C's and D's. Patient returns to the office for an injection ordered during the last E&M visit. That doesn't qualify for a modifier. That qualifies as a nurse visit only. We're looking for which one qualifies for a nurse visit. So it would definitely be D. Yep, D for that one. Good job. Let me see what the next one is. Oh, this is a good one too. Okay, we'll keep going. Another one for which modifier begins a new global period for an unrelated procedure? Is it 25, 78, 57, or 79? '79 is unrelated procedure on the same day during postoperative period. 57 is decision for surgery, which is interesting because that might start a whole new thing too. 78 is unplanned return back to the OR during a postoperative period, and then 25 is 2 E&M visits. It is your 79. Good job. Which type of font indicates new additions and revisions in the CPT code book each year? Is it green, red, bolded, or italic? Critical assessment hospitals. Kind of like rural hospitals. Green, good job. Yes, indeed. Oops. Did that one, did that one, did that one. And I was just trying to scoochie that down. There we go. What modifier is applied to this office visit? We have 55, which is postoperative management only. 78 is unplanned return back to the OR during a postoperative period. 58 is staged during a postoperative period. And 57 is decision for surgery. What do you guys think? Which modifier is correct for this particular patient? 57? I got to vote for that. $57 is our decision for surgery. Perfect. Good job. Immunizations. They're always so much fun. Love immunizations. First thing you need to do is decide if you are a 60 or a 71. And you look through the question for one particular word. That will help you get rid of 2 answers. And you'll be down to a 50-50 shot for this question. Do you know what that one little word is? Sorry if this is a silly question. Will I be able to have a box of Kleenexes? The kids shared and my nose is starting to run. Oh no. Just make sure it doesn't have any writing on it. You may have to pull out the tissues and just have them separate out of a box on your desk. They kind of frown on boxes, you know, things on your desk. I know I had a Kleenex on my desk, but I only needed one tissue. So I had one on my desk, but I took it out of the box, if that makes any sense. They didn't ask me to do that. I just did it on my own like that, just to make sure they didn't have nothing to grumble about, you know? Nothing is ever a silly question. Ask away. Especially while you got me in front of you. So we're looking for the word counseling with this one. Was the patient and parent counseled today? Doesn't look like it. Looks like it's just a return back to the office for a vaccine, and it looks like just the nurse confirmed the order and gave the shots, right? So no counseling would be done. Then it's just a matter of the 10 or the 7. Which one did you give? I think one of them includes varicella and the other one's just MMR vaccine by itself. Everybody get C? Perfect. Good job. Which one of these scenarios qualifies for modifier 22? Looks like, let me get this up here so we can get D all in the same thing. Okay. There we go. Is it a patient 5 days having a lumpectomy of the breast, attempts to perform a foreign body, presents for follow-up, or returns 3 days later? So 22 is an increased procedural service. Which one of those scenarios would qualify for that? Lots of B's. B it is indeed. We just needed to find the procedure that was actually going on right then and there. Nothing that was a return, Nothing that it was a follow-up. None of those 5 days later could have been correct for 22. Perfect. All right, what's our headers? Are we in critical care? Or are we 471? That's NICU or some sort of admission into critical care unit. What page is the vaccines on? In the CPT book? Depends on which vaccine, but 749 to 53 has quite a few of the vaccines listed in them. If you're in the 2024 book. Is that helpful? I hope that's helpful. How many have we got on right now? Only 30 people remain. We did have 40 something. Let's give out some subscription memberships. So be sure and chat into chat. That way you might be picked as a winner from YouTube. Let's see. SK, Kelly, Katrina, Scarlett, and Sam all won a month's free YouTube membership. Now you've got access to all the exclusive data on my YouTube channel, where you get to see all the repeat workshops and stuff. Yep. I hope that's super helpful. Thank y'all for hanging out and doing this with me. I hope it is helpful for everybody that's doing their exam this week. You're welcome. Our answer is C with this one. Did anybody get that one right? Yep. Lots of C's. Yep, make sure you do have it pushed on the screen, and will allow you to accept gifts. Yes, absolutely. A lot of people already have that pushed, but yes, it is good to make sure and verify. There is a straggler gift out there. There it goes. One more. Lindsay won that one. Congratulations. I hope that is super helpful. Tons of videos that are not available to everybody. Like duck classes have 50 practice questions in them that are super difficult and very hard. All the workshops have 75 practice exam questions in them. Super cool. All right. Are we in the medicine section or in the E&M section, or are we in category 2 codes in the back of the book? What's going on here? If we have an attending provider at the hospital who spends 25 minutes on a patient in the morning and then another 15 in the afternoon examining the patient, writing discharge orders and instructions for a patient, what do we code? Just add up your time and get D for this one. Total time spent with the patient was 40 minutes. So we picked our D, not A, for this one. Wonder how they got 40 minutes for this. I'm only getting, yeah, that's 40. That's 10, carry the 1, that's 40. Yep, it seems like it's smaller, but it is. That's 40 minutes. The other two are just supplementary codes. Nothing that we would use in the office. All right, are we going to do the 52 modifier, 74, 73, or 53? 52 is reduced services. 74 is another discontinued outpatient after anesthesia. Is it after? I always assume or prior, after. And then 73 is discontinued prior to it. And 53 is a discontinued procedure. All of them are discontinued. I got B's, A's, D, B. Could not finish the procedure because the patient went into respiratory distress. Be sure and write respiratory distress beside the modifier when you figure out which answer it is. '74. It's all about the anesthesia. Whether we put them under and got them under and then we had to stop it. That's the situation. What does the abbreviation for this word look like? Do you know how to find your abbreviations in the book? Do you have extra ones listed? D is correct. Good job. Ooh, I like this one. For code 36215, it's a selective catheter placement in the arterial system. Each first order thoracic or brachiocephalic branch within the vascular family. Which appendix will help you determine the answer to that question? Appendix A, D, G, or L? Yep, Appendix L. I like my cardiology notes because I go through that Appendix L section and put in the CPT codes that mean each branch, and a lot of them anyway, and then color code them a little bit better and write in which ones they are, whether they're first, second, or third, because it's really hard to tell by the color coding whether they are or not. So I like the way I went through there and did that. I think it's helpful. All right, we got two doctors who performed on the same patient a set of procedures. How do we bill for today's services on this patient? Lots of B's and A's. So what did the doctors do? Dr. A does an open treatment of a fracture, does this procedure. Dr. B does a complex closure on the patient. So if we have two doctors and they do two different procedures, do you need a modifier? Nope, right? Because they're not doing anything, you know, together. So you know your answer is A with this one. Yep, very good. Good job. Don't assume because there's two doctors that you automatically have to have that 62 modifier. Just make sure, verify that you see that they work on the same procedure for the same patient before you code that modifier. What do we think our answer is for this next one? We've got two codes that are in the 5 or the 3 4s. And then we've got two codes that are in the 3 5s. It's about all the similarities we got. We got 3 of them that end in 1 and 1 that doesn't. First thing to note is whether you are in a vein or an artery. A lot of times in cardiovascular, it's just knowing whether you're in a vein or an artery, which makes things super helpful. One lonely old little C. C is correct. We were doing a blood clot removal and we were dealing with just the veins. Helps you get rid of anything else that doesn't have a vein included. This is cool because we have some with modifiers and some procedures without. 3 of them start out with the 75. And then one of them is 75 done twice with the 59 modifier, or they move on to the 76. What's going on with these codes? 36475. What do you guys think is the answer? Lots of do nots around here. Seven five and 7-6. 7-6 is an add-on code. Definitely wouldn't need a modifier with an add-on code, would we? If that's an add-on code. Wouldn't need a modifier to go along with it. What else can you tell? So is the 79, that's an add-on code. This one is just for the very first one, so it wouldn't be for the second one. Can't use that. Probably don't use that. So just a difference of knowing whether you're doing a 76 or a 79. Perfect. Good job. Excellent, excellent. Let's do another one of those. We've got 6, 5, 5, 8, 6, and then we've got the 63s. We either have injections being able to be coded also, and we do have different diagnoses. 2 of them are the 8s or the 9s. I'm gonna let my cat in. She's annoying the heck out of me. Yelling at the door. Come on. Come on. Come on. Yeah, come on. There you go. All right. 365. 5, 6. We're doing a non-tunneled if it's that. Which one is called infused point pump? 2. Do you have those marked down? That can be super helpful during the exam, is to have these name brands written beside the correct answer, so that when you see that name brand written again during an exam question, you'll know exactly which answer is going to be correct. 6563 is tunneled, so we have non-tunneled and tunneled. Knowing if you're doing that or the other is super helpful. Can I explain the last one? Yep. So, first thing is 75, or 75, 6475. Get back over there. So, let me make this smaller. Okay. So our 6475 is a parent code. Like, it's a code that doesn't have any symbols in front of it. It's indented all the way over. So I know it's a start off. And then the 75 and our 79 are add-on codes. And I know my rule with those is we don't add a modifier if we're adding any of these. Anything with the plus symbol in front of it does not get a modifier. So the first thing I can do with my practice question, or my exam question here, is if I see a 76 right there and it has the modifier attached to it, that's wrong. I know that's a coding irregularity. I know I can get rid of that. And since the 75 is for the first vein, if I had a second vein, that's what my subsequent 76 is for. So I can't code this twice for the first vein on one procedure. I'd have to have 2 patients or 2 different hearts or 2 different whatever. You'd have to have 2 separate, totally complete procedures to be able to bill this twice. And I know we can't do that. So that, again, is another coding irregularity. So that just helps me get rid of these just because I know what the differences are between a plain code by itself with no indentation and what add-on codes are. This, just simply looking at this book helps me get rid of those two answers. Now, my difference between A and C is just the 79 and the 76. 79 is for extremity, single extremity, each through separate sites. How do we know? This one's treated. This one's treated. Separate access pipe through separate access pipe, single extremity, single extremity. This add-on code for our 79 only goes with our 78, and then our 76 only goes with our 75. So we have to look at our 78 to see what our differences are. So our 78 and our 75 differences is ablation therapy, incomplete vein, extremity, all images included, first vein, percutaneous with radio frequency. This one is laser, and this one is radio frequency. So did we do radio frequency or did we do laser? So we look at our question, and our question says radio frequency. So that gets me back to knowing that I have to code the 75. I can't code the 78. So really, that's the only question, the only word we needed to look up in that question is just that one word in the question, was whether we did radio frequency or laser. Laser, radio. That's it. That's our differences. Does that help out? Tunneled and non-tunneled again. Yep. So our 6556. All of these codes, starting with our access devices, they're either non-tunneled or tunneled. And that's the first thing you're going to clear when you're in this section doing access devices that we access and we draw blood from or we add meds to. We need to know if they're tunneled or non-tunneled. So 558 or 556 is a child code, which we can't do nothing with it. We have to go look at its parent code, which is the one up above it, which is the non-indented one. And the first thing we're going to know is that this one, because it's a child code of 55, is that it is non-tunneled. So clearing those is usually helpful during these questions. That one's non-tunneled. The 5.6 is non-tunneled. 5.8 is tunneled. 5.8 is tunneled. See, it's a child, but it's tunneled under the 5.7. So that's tunneled. And then our 5.6.6.3. It's one of those things that may not be helpful for this question, but it's what I always go to look for in these questions in this section, because there's usually something different, and those are both tunneled. You can also see that some of them include a pump and some of them won't. The 63 includes a pump. '56 does not have a pump. 58 has a pump. Are you centrally inserting them? central venous, good. This one is 57 and 58 is a catheter, where 6563 is an access device. What did we insert today? Did we insert a catheter? Did we insert a pump? Did we insert an access point? What is an infuser pump? Installation. What is that for? Lots of A's. C, guys, C. We've got two answers with the same answer, and they just want to know if we can bill the hip picks or not. And we did do 3 rounds of the medication, so we do get to bill it. So if you go to 36563, we did an access device, and be sure to write that particular word, infuse add pump, next to the CPT code, so that you guys will know next time that this is an access device. Of course, access devices are, and they do include, and they are catheters. Even when you have patients say that they don't say that they had an access device implanted, that they had a catheter implanted around their heart, you know. Be sure and pay attention when they put the same answer down twice. Usually it's just a difference between those two codes. You can exclude A and D, A and B right away. You wouldn't even have to look those up and get confused. Then you just need to know whether you're going to bill your hip picks or not. And it's listed there, and it's 500 milligrams each one, so you have to do 3. Makes it a lot easier when you just do the process of elimination. What do you guys think about the next one? We got 3 of them with the same answer. I think we've seen this question a bunch. 929, 929. Two 8. percutaneous, transcatheter, intracoronary stents, intracoronary stents, placement percutaneously, that all jives. If you do your 9 to 933, that's percutaneous transluminal coronary arthroectomy. And it does have intracoronary stent, but it's got a lot of other crap goes along with it too. We got right and left. We do have transluminal balloon angioplasty listed there, done on the left coronary artery. I'm glad we're going over it too, Go-Kart. Hope that's helpful. Great, Leanne. Glad that helped. All right, what do you guys think the answer is for this one? If I'm not around to help, what are you guys going to answer? What's going to be your answer? D is correct on this one. See a lot of B's. Let's look at our differences. 2, 8, 2, 9, and 20. Versus our D's, the 2, 8, 2, 8, and 20. So it was just a difference between these is what we got confused on. 9, 2, 9, 28. Each additional branch of a major coronary artery. Single major coronary artery or branch, whether you did each additional branch. So we did the right coronary and the left ascending arteries. So let me see if I can't figure out a way to explain this. That's kidneys. Right coronary artery. Versus the left ascending, descending. Right and left common carotid. Yep. Right, and then the left anterior descending. So if we went right coronary, that's right carotid, right carotid. Subclavian coronary, right and left coronary, first order. And then our left and right ascending. Left anterior descending. I need to be able to do a word search. Your appendix L is going to do a lot for trying to show you what you did here or didn't do. Our right and left coronary are first order, right? And that's where our 28 is. Our left anterior descending arteries. Versus if we were doing the 2-9. They're saying that there's only 5 major coronary arteries: the left main, the left anterior descending, the left circumference, the left coronary artery, and the RI. Because we did yep, in the same, yep, we did LD, left descending, and right coronary, matching up your, they had them all the same on every single one of them, so that's not really helpful. We know our balloonplasty is the 40. Yeah, there are some really good illustrations. I was trying to use, I like this one in Appendix L that has the heart and stuff drawn underneath it too that you can use. We've got our right and left carotid right here. I've got the CPT codes that go with it, but mostly the ones from the cardiovascular system instead of the medicine section. I was thinking, while I was here, I should add the ones from the medicine section for this year into these, because it seems I just have the ones from the cardiovascular system in this one. Marking up which ones are ascending, or the first or second or third, is super helpful. It's just a matter of whether you went into this artery and stayed in it and stayed in that one branch, or whether you started another branch and went into a different one for the second stent. It's just the differences between those codes. Knowing whether you stayed in that one and kept going through it, or if you started another one. See if I got one more thing. Maybe I can explain it better. Maybe. Oh, and I need it to be not that one. Let's see if I got something better over here. 2. And our 929. Nothing major there. I did, though, in my notes, in case you guys haven't done it yet, you could write those acronyms at the top. I've got the LD branches are diagonal. I don't know if this will focus on it. So that you know which way we're going, right? The LC branches are marginal. The RC branches are also posterior and they're descending. We don't do any add-on codes for the ML and RC branches. Other things that are helpful is if you know that the 2-8 does stents and angio together, where the 3-3 does a stent and angio with the resection, so that's helpful. The 3-7 is a revascularization, but we start off, with just the 20, it's only doing the angio, and then we move to the 24, that's doing the angio with the removal, the arthroectomy. So it's helpful to start out and know what's going on in each 2 set groups of codes, and that's helpful. And then any kind of names, like that's just the name of the stent. TAXUS is just the name of the manufacturer's name of the stent. I put that down one time, but this particular time we don't use the additional add-on code. We code this thing twice because we're in 2 different LDs and RCs in the branches. And we just add those modifiers to them. And they just want to know if we know when to use the add-on code and when not to use the add-on code. I should find another example question where the next one uses the add-on code, and put those 2 questions together so that we can do them together so you can see the differences. I'll try to find that for Tuesday's live. Be good. All right, we got radiology, a difference between the 53 and the 51. That's the first thing I deal with for worrying about all this other stuff. But we do have 2 codes, 4 codes, 3 codes, and 4 codes, just as far as the numbers of how much is in each one. 7, 8. Seven, 8, 4. 7, 8, 4, 5, 3. Versus 5, 1. What is our differences? They both start off with the same wording. One of them is PLANAR, and one of them is spec with the tomographics. So that's helpful. You can get yourself down to a 50-50 shot with that. Then you just need to know, are we doing another radiology or something from the medicine section? What do you guys think is the answer? Couple of C's. Perfect. Good job, guys. It was a hard one tonight. I hope this was helpful, though. I will be back on live, probably on TikTok. I've got plenty of other stuff to do this weekend, but not a lot that's going to keep me out of the house. So we're just trying to clean the shed. So I should be able to go live quite a bit for some bonus material, and I hope TikTok records the videos so that I can put them back up on YouTube. What is this? Where is this word? Word. Switch this over to here. Ooh, that's awful tiny. This was one question that somebody said was on their exam. I don't think I put the answer down yet, but don't forget to pay close attention to these knees. If anybody's taking this exam anytime soon, knowing whether you did both or just one of the knees is super helpful. This one ended up being just one side of the knee, even though we went in on the left and did something. Yeah. Just pay close attention to those knee codes. That's super helpful. One of those with the stress test, it was kind of close to those EKG codes that was on somebody's exam recently. Cardiac stress test. So be sure you know the differences between the 930-16s and the 15s, and whether you would add the 26 modifier or not. That's super helpful in that area. But I should be able to go live. I shouldn't should be around. We're just cleaning sheds out and getting out the Easter decorations and trying to make more room in the garage. But I hope this was super helpful, guys. Don't forget about the website. Oh my gosh, I got so much stuff. And new on the website, I've got a ton of new practice questions Don't forget here on the YouTube channel to be sure and check the community page. It has tons of practice exam questions too. I try to change those daily. My website, I'm trying to add more stuff there. There's a PDF you can download for cardiovascular right now. It's a PowerPoint presentation. I've been trying to do some more. I guess that has to do with, I have to do the window for this. Yeah, those. These charts, been trying to work on doing some of these, bringing those up from when I did these years and years and years ago. I don't know how helpful they'll be. This is helpful if you know what organs are inside the umbilical regions, which organs are inside the left lumbar. That's helpful. That's what I have in my notes, but I've got this diagram in it, but I've got which organs are inside each one. But this is kind of helpful because you can see which ones are in there, but having the words written down is super helpful. Knowing that the muscular system, what it does, it enables movement. What does the nervous system do? It detects and processes sensory information. That's all super helpful. I love the charts that do one little word things like that. There's our label of our heart, our capillaries, some of our carotids, ulna, common. There's our veins, deep and knowing whether they're superficial or not. Our breathing. Yep. That's really cool. Thyroid. Lungs. How many lobes? It's always good to know what's going on in our pleural cavity. Increase, decrease. You don't need to do the math on any of that. For you guys, midbrain, medulla, digestive system. It's kind of handy, but I'll add these PowerPoint
Jennifer
presentations
Christian has become a member
to the website so that you guys can download these too, just in case they're helpful for you guys. I'll add them into that practice page on my website. So be sure and go to medicalcodingbyjen.com, go to the practice area, and I'll post up some more of these PowerPoints just in case something here is super helpful for you guys. The muscles. Yeah, a little bit too in depth, but some of it is handy dandy. Tres minor, I've seen that in a practice question before. And the differences between the CPT codes was whether it was superficial, muscular, or down to the bone. So if you see any muscle words, then you know it's there. The keratin is good to know where it's located in your skin. But yeah, I'll get these posted on the website, so be sure and check back to it often. I hope this is helpful. I love you guys. I'll see you back on TikTok for this weekend, but if not, I'll be back here on YouTube on Tuesday and Thursday next week, and we'll be on TikTok on Monday and Wednesday. Thanks, Jen, for joining the Medical Coding Club. I hope it's super helpful for you guys. Yes, we can do more for the LC and LD questions for sure. I'll populate some of those in for our next live too, because we definitely need more work on those and make sure that we get all of our notes done for that. I hope that's super helpful, guys. Proud of you guys. Y'all be good. Best of luck for anybody taking their exam.